The metal tray slid across the sterile surface with a soft scrape, its contents catching the white overhead light. Gauze rolls, gleaming scissors, glass bottles of amber liquid, each perfectly aligned. Private Ernst Mueller watched the American nurse arrange them with methodical care, her movements unhurried despite the ward full of patients. His fingers traced the clean bandage wrapped around his forearm where shrapnel had torn the flesh 3 days earlier. In the field hospitals of North Africa, such a wound had meant hasty cleaning, if any, and a scrap of fabric often reused from another soldier. Here, in this American prisoner of war hospital in Virginia, his arm had been x-rayed, cleaned with solutions that smelled sharply of chemicals, stitched with thread finer than any he had seen, and wrapped in pristine white gauze changed twice daily. The nurse glanced up, catching his bewildered stare. She smiled briefly before moving to the next bed where another German prisoner lay recovering from surgery. Mueller closed his eyes, remembering the whispers that had circulated through their unit before capture, that the Americans executed prisoners or left them to die from their wounds. He had believed those stories with the certainty of a man who had spent 4 years absorbing the Reich's propaganda. Now, the cool antiseptic air filling his lungs told a different story altogether. Kaute die Medizin, he whispered to himself, an old saying from his grandmother. Count the medicine. It meant to be grateful for what you have. But here, there seemed to be no counting necessary. The shelves lining the ward contained more bottles, more bandages, more medical supplies than he had seen in entire field hospitals on the front. For the first time since his capture, Mueller felt something beyond fear or resignation. It was a dangerous feeling, one that threatened everything he had been taught to believe, a feeling of doubt. The doubt would only grow stronger in the days ahead as he and hundreds of other German prisoners confronted the reality that their captors possessed not only superior weapons and numbers, but something far more unsettling, an abundance so vast that even enemies received care beyond imagination. It was a revelation that would fracture their worldview more effectively than any bullet could penetrate armor, leaving them to question not just the outcome of the war, but the very foundations upon which their belief in German superiority had been built. The journey had begun weeks earlier for Mueller and his comrades, captured during the final collapse of German forces in Tunisia. They had prepared themselves for brutality, repeating stories of American savagery whispered through the ranks. Even as they were herded onto transport ships, many believed they were being taken to their execution. The crossing had been grueling, crowded conditions, the constant roll of the Atlantic, the uncertainty of what awaited them. But there had been no beatings, no starvation. The American guards had been brusque but professional, offering regular meals and even occasional cigarettes. Upon reaching American shores, they had been separated. Those requiring medical attention diverted to hospital facilities scattered across the eastern states. Mueller, his arm throbbing from the shrapnel wound that had festered during the voyage, found himself among 50 others loaded onto army trucks bound for a converted civilian hospital in Virginia. The fear had been palpable among them, men whispering final prayers, clutching hidden photos of loved ones, preparing for the worst. When they arrived at a sprawling white building with manicured grounds, confusion replaced fear. This was no execution ground, but a proper hospital with wings and corridors and a red cross emblazoned clearly on its roof. Guards had escorted them inside, where American medical personnel waited, not with instruments of torture, but with intake forms, thermometers, and calm professional expressions. "Remove your uniforms," the translator had instructed. "You will be examined for wounds and illness." Some had hesitated, certain this was the prelude to humiliation or worse. Mueller remembered one officer, Lieutenant Weber, refusing to remove his jacket until a guard simply pointed to an American soldier also being treated in a nearby room, similarly undressed and undergoing examination. "They treat their own the same," the translator explained, a statement so simple yet so contrary to everything they had expected that it left them momentarily speechless. The examinations had been thorough but impersonal. American doctors moved from bed to bed, checking wounds, taking temperatures, ordering x-rays and blood tests with a mechanical efficiency that suggested this was routine, not the examination of enemies, but simply of patients requiring treatment. Mueller had watched, bewildered, as a young doctor carefully unwrapped his infected arm, examined the wound, and then, without hesitation, ordered a course of treatment that would have been reserved for officers in German field hospitals. Penicillin, the doctor had said to the nurse, prescribing the medicine as casually as one might order a cup of coffee. Mueller had heard of this drug, a miraculous new treatment that Germany possessed in quantities so limited that only the highest-ranking officials or the most valuable specialists might receive it. Yet here it was, being administered to a common soldier, a prisoner no less, as though supplies were unlimited. That night, lying in a real bed with clean sheets, Mueller had stared at the ceiling, his mind racing. The hospital ward hummed with quiet activity, nurses making rounds, the soft clink of instruments, the occasional moan of a patient in pain. It was not the sounds that kept him awake, but the implications of what he had witnessed. If the Americans could spare such resources for their enemies, what did that reveal about the true state of the war? About the Reich's chances? About everything he had been told? The soft footsteps of a night nurse passed his bed. Mueller closed his eyes, feigning sleep. But the questions remained, circling like wolves around the edges of his consciousness, threatening to devour everything he had once held certain. The morning brought new revelations. Breakfast arrived on trays. Real eggs, toast with butter, coffee with sugar. Portions that seemed extravagant compared to the meager rations German soldiers had subsisted on for years. Mueller ate slowly, savoring each bite, watching as the American orderlies distributed meals with the same efficiency they handled medical supplies. Across from him, Feldwebel Gerhard Krause, a weathered veteran of the Russian front, stared at his plate with undisguised shock. "This is prisoner food?" Krause muttered, breaking the unspoken rule against showing weakness before the enemy. "My family in Dresden hasn't seen an egg in 2 years." Others nodded silently, the comparison hanging in the air between them. Mueller had joined the Wehrmacht believing in German efficiency, German organization, German superiority. Yet here, surrounded by evidence to the contrary, those beliefs felt suddenly hollow. The Americans moved with a casual confidence that suggested not just military might, but a foundation of abundance that the Reich, for all its discipline, could not match. After breakfast came another surprise. Orderlies distributed clean hospital gowns and toiletry kits containing soap, toothbrushes, combs, even small tubes of toothpaste, items that had become precious luxuries in Germany. Mueller held the toothbrush in his hand, examining its plastic handle, the evenly cut bristles, the clear signs of mass production rather than the makeshift substitutes common back home. "For us?" a young private asked the orderly, his disbelief evident. "Standard issue," the American replied with a shrug, the words translated by a German-American nurse whose accent revealed her origins in Bavaria. "Everyone gets the same." Standard issue. The phrase echoed through Mueller's thoughts as he followed the others to the washing facilities. Standard meant normal, expected, unremarkable. Yet what was standard here would have been unthinkable luxury in the German military hospitals he had glimpsed during his service. The washing room itself deepened his shock. Rows of sinks with running hot water, shower stalls with metal pipes delivering steady streams rather than the occasional bucket of tepid water he had grown accustomed to on the front. The men hesitated before this bounty, uncertain if they were truly permitted to use it freely. An orderly noticed their confusion. 10 minutes each for showers, he instructed through the translator. Use the soap. Doctor's orders. Clean bodies meant fewer infections, fewer complications, the nurse explained. It was not kindness but medical protocol, efficiency rather than generosity. Yet the result was the same. German prisoners standing under streams of hot water, watching dirt and grime from the battlefield spiral away down drains, replaced by the unfamiliar scent of standard-issue soap. Later, as a doctor made rounds checking wounds and changing dressings, Mueller finally found his voice. "Why?" he asked simply, gesturing to his cleanly bandaged arm, the antibiotics, the whole pristine ward. The American doctor paused, perhaps surprised by the directness of the question. He was young, probably fresh from medical school, with the earnest expression of someone who had never known real deprivation. "Why what?" he asked through the translator. "Why treat us this way? We are enemies." The doctor seemed genuinely puzzled by the question. "Your patience," he replied, as if this explained everything. When Mueller's confusion remained evident, he elaborated. "The Geneva Convention requires proper medical treatment for prisoners of war. But more than that, this is just how we practice medicine. Enemy or not, a wound is a wound." The words were delivered without propaganda, without the sense that they were meant to impress or convert. It was simply a statement of fact, a glimpse into a worldview so foreign to what Mueller had been taught that he could barely process it. In the Reich, resources were allocated based on value to the state, on rank, on racial categories carefully delineated by law. The idea that medical care might be standardized, might follow protocols regardless of the patient's identity, this was as alien as the abundance of supplies that made it possible. Besides, the doctor added with a hint of pride, "we have enough to go around. No need to ration care when you've got the best medical system in the world." It was said without malice, not as a boast directed at the prisoner, but as a simple truth the American believed wholeheartedly. Mueller watched him move to the next bed, the statement hanging in the air like a challenge to everything the Reich had claimed about American weakness, American inadequacy, American decline. That night, the ward grew quiet, except for the soft footfalls of nurses and the occasional cough or moan. Mueller lay awake, his mind racing through implications he scarcely dared acknowledge. The Americans had this much medicine, this many doctors, this level of organization just for prisoners. What did their actual military hospitals look like? What resources did they command for their own citizens? And if this wealth extended beyond medicine to food, equipment, fuel, how could Germany possibly hope to win? The questions felt dangerous, treasonous even. To doubt the Reich's propaganda was to doubt the Reich itself. Yet surrounded by the evidence of his senses, the clean sheets, the regular meals, the constant supply of medicines that would be considered precious treasures in German hospitals, doubt crept in regardless, impossible to ignore. Across the ward, someone was crying quietly. Mueller recognized the sound, not the crying of physical pain, but the deeper, more wrenching sobs of a man whose certainties were crumbling. He had heard it before, in the final days before their capture in Tunisia, as soldiers realized that the promised reinforcements would never arrive, that they had been abandoned to their fate by leaders who continued to promise victory despite all evidence to the contrary. He turned his face to the wall, unwilling to witness another's breakdown, yet unable to escape his own growing sense that everything he had believed might be built on lies. The medicine cabinet across the room stood illuminated by a small nightlight, its shelves lined with bottles and supplies, a monument to American abundance that challenged the Reich's promises more effectively than any propaganda leaflet could have done. The American hospital routine established itself with the same efficiency Mueller had once believed was uniquely German. Morning rounds, medication distributions, physical therapy sessions, meal deliveries, all occurred with clockwork precision. The staff moved with the confidence of people unburdened by shortages, by the need to improvise or substitute. When supplies were required, they appeared. When equipment was needed, it was available. 4 days after his arrival, Mueller was taken to another room for what the nurse called a follow-up X-ray to ensure the shrapnel had been completely removed. The machine itself was remarkable, newer and more advanced than anything he had seen in Germany. The technician operated it with casual expertise, positioning Mueller's arm, adjusting settings, producing clear images of his healing bones within minutes. "We do this for all fragment wounds," the technician explained through the translator. "Standard procedure to check for metal pieces we might have missed." Again, that word. Mueller was beginning to understand that what the Americans considered standard, basic, unremarkable, would have been extraordinary luxury in German military medicine. The realization was both fascinating and deeply disturbing. In the recreation room where ambulatory patients were permitted to gather during afternoon hours, conversations increasingly centered on these contradictions. Initially guarded, speaking in whispers for fear of informers or punishment, the German prisoners gradually became more open in their comparisons. The Americans, it seemed, either didn't care about such conversations or actually encouraged them. "My brother lost his leg at Stalingrad," Corporal Heinrich Bauer said quietly, his voice carrying only to the small circle of men playing cards at his table. "He wrote that they ran out of anesthesia halfway through the operation. The doctor gave him a strap of leather to bite down on while they sawed." The others nodded grimly. Such stories were common, accepted as the necessary hardships of war. Mueller had never questioned them before. Now, watching an American doctor administer painkillers to a prisoner with a migraine, the contrast was impossible to ignore. "Here, they give aspirin for a headache," Bauer continued, disbelief evident in his tone, "like handing out candy to children." Private Walter Schmidt, the youngest among them at barely 19, looked up from his cards. "My sister is a nurse in Hamburg. She uses paper bandages now, washes them for reuse. She told me they dilute medications to make them last longer." He glanced around nervously, as if saying such things might still be punishable. "How can they have so much when we have so little? We're supposed to be the master race." The question hung in the air, unanswerable yet unavoidable. Mueller laid down his cards, no longer interested in the game. Through the window, he could see an American supply truck backing up to the hospital entrance. Orderlies emerged, unloading crates with efficient movements. More supplies, more medicine, more evidence of an abundance that challenged everything they had been taught about their own superiority. "Perhaps," Feldwebel Krause said carefully, "we have been told things that are not entirely accurate." The understatement almost made Mueller laugh. Not entirely accurate? As if the gap between their expectations and this reality could be explained by a simple miscalculation. Yet no one contradicted Krause. To do so would require acknowledging a deception too vast, too complete to process all at once. That evening, a new patient arrived in the ward, an American soldier with bandages covering his chest and arm. Mueller watched with intense interest as the staff attended to him, looking for any sign that their own countrymen would receive preferential treatment. To his surprise, the procedures appeared identical. The same intake forms, the same examination protocols, the same medications administered with identical efficiency. "They truly do treat us the same," whispered Schmidt from the neighboring bed. "Why would they waste such resources on enemies?" Mueller had no answer, but the question itself revealed how thoroughly their captivity had already changed their perspective. 2 weeks earlier, they would have unquestioningly accepted that Germans deserved the best of everything. Now, receiving medical care indistinguishable from that given to Americans, they found themselves wondering why their enemies would waste equal treatment on them. The shift in viewpoint was subtle but profound. The American patient, a sergeant named Collins, according to the chart hanging from his bed, regarded the German prisoners with mild curiosity but no evident hostility. When a nurse came to check his bandages, Mueller overheard him ask about the Germans in a tone that suggested simple interest rather than animosity. "They're patients," the nurse replied, matter-of-factly. "Same as you." The simplicity of the statement struck Mueller with unexpected force. Patients, not prisoners. The distinction seemed meaningful somehow, suggesting a worldview where professional obligations transcended national boundaries, where human needs outweighed political divisions. It was alien to the totalizing ideology he had absorbed in Germany, where every aspect of life was subordinated to the needs of the state and the party. That night, listening to the quiet movements of the night shift nurses, Mueller found himself wondering what else might be different if one started from such premises. If even enemies deserved standard medical care, what other beliefs might follow? The questions felt dangerous, revolutionary even, yet he could not stop them from forming. On the 5th day, Mueller witnessed something that shattered what remained of his preconceptions. A team of surgeons arrived to perform a complex operation on a prisoner with a severe abdominal wound, a procedure requiring specialized equipment, multiple personnel, and significant resources. The man was not an officer or someone with valuable intelligence. He was a simple radio operator, a nobody in the Reich's hierarchy of worth. They're flying in a specialist from Johns Hopkins, Mueller overheard an orderly explain to the translator. Dr. Halstead pioneered this technique. Best chance to save him. Flying in a specialist. For a common soldier? For an enemy? The concept was so alien to Mueller's experience that he struggled to comprehend it. In the German military hospitals he had glimpsed, resources were strictly rationed according to rank, strategic value, and likelihood of return to duty. The idea of expending extraordinary measures on someone who, even if saved, would remain a prisoner, it violated every principle of wartime triage he had been taught to accept as necessary and proper. The specialist arrived later that day, a civilian surgeon in his 50s with graying hair and the confident bearing of someone at the top of his profession. Mueller watched through the ward windows as he was escorted in, carrying a leather case presumably containing specialized instruments. There was no ceremony, no sense that this was unusual. Just another doctor arriving to perform his duty regardless of who lay on the operating table. Would they do this for their own? Krause asked, standing beside Mueller at the window. They already do, replied Bauer, who had spoken with an American orderly through the translator. Apparently, this doctor regularly travels to treat their wounded. They have a whole system for moving specialists wherever they're needed. The implications were staggering. Not just abundance of supplies, but abundance of expertise, of transportation, of organizational capacity, all deployed with an efficiency that made a mockery of the German propaganda about American disorganization and waste. Mueller turned away from the window, suddenly needing to sit down as the weight of these realizations pressed upon him. The radio operator survived the surgery. Within days, he was recovering in the bed across from Mueller, receiving the same attentive care, the same medications, the same specialized follow-up treatments that would have been reserved for generals in the Wehrmacht. Watching the daily change of his dressings, the careful monitoring of his condition, Mueller finally articulated the question that had been forming since his arrival. "How can they afford all this?" he asked Krause quietly. Not just the supplies, but the doctors, the specialists, the whole system. Germany is the industrial powerhouse of Europe, yet we haven't seen this level of medical abundance since before the war. Krause, who had worked in a munitions factory before being drafted, considered the question with the seriousness it deserved. "Production capacity," he finally replied. "America hasn't been bombed. Their factories run day and night. They have resources we can only dream of. But it's more than that," Mueller insisted. "It's priorities. They're choosing to use those resources this way, even for us." "Yes," Krause acknowledged, his voice heavy with implications neither man wanted to fully explore. "That is a choice that reflected values, systems, and capabilities fundamentally different from those they had been raised to believe were superior." The silence that followed was filled with unspoken recognitions too dangerous to articulate directly. If they were wrong about this, what else might they be wrong about? The following week brought a new dimension to Mueller's education. A group of German medical officers, doctors who had been captured alongside regular troops, were brought to the hospital ostensibly to assist with the care of their countrymen, but clearly also to observe American medical practices. Mueller watched their faces as they were shown around the facility, recognizing in their expressions the same shock, disbelief, and reluctant admiration he had experienced days earlier. One of them, a Captain Schmidt, was assigned to Mueller's ward. He moved among the beds with a stiff formality that contrasted sharply with the relaxed proficiency of the American staff. When he reached Mueller's bed, he examined the healing wound with careful attention. "The Americans treated this?" he asked quietly in German. Mueller nodded. "From the first day. X-rays, antibiotics, daily dressing changes." The doctor's face remained professionally neutral, but something flickered in his eyes. Recognition, perhaps, or resignation. "They are using sulfa drugs and penicillin for routine wounds," he observed, keeping his voice low. "We reserve such treatments for—" He didn't finish the sentence. But he didn't need to. They both knew that in German field hospitals, such medications would be reserved for officers or specialists deemed essential to the war effort. Ordinary soldiers made do with basic antiseptics, if those were even available. Their supply lines must be incredible, the doctor continued, almost to himself. We haven't had reliable penicillin deliveries since '43. Later, Mueller overheard the German medical officers talking among themselves in the corridor, their voices carefully controlled, but their words revealing. They spoke of techniques they had never seen, equipment they had only read about in medical journals, procedures that in Germany remained theoretical due to resource constraints. Their professional admiration warred visibly with their patriotic reluctance to acknowledge American superiority in this domain. Their blood banking system alone, one said, shaking his head in a mixture of envy and respect. We could save so many more of our boys if we had even a fraction of this capacity. This is what happens when factories aren't being bombed daily, another replied bitterly, when supply chains remain intact. It's more than that, insisted the third, echoing Mueller's own earlier realization. It's systematic. They've built this infrastructure over years. The prioritization, the standardization, it's not just about resources. Their conversation shifted to technical details beyond Mueller's understanding, but the implications were clear enough. These were not just doctors, but German officers, men carefully selected for their loyalty to the Reich. Yet even they could not deny the evidence before them. American medical capabilities were not just different in degree, but in kind, reflecting a system whose foundations were stronger, more advanced, more abundant than anything they had experienced. That night, a storm lashed the hospital windows, rain beating against glass panes with rhythmic intensity. The power flickered once, twice, and Mueller tensed, expecting darkness to descend as it would have in any German facility during such conditions. Instead, the lights steadied, and within moments, the soft hum of a generator could be heard from somewhere outside the building. Backup power, automatically engaged, ensuring that vital equipment continued functioning without interruption. A small thing, perhaps, but it struck Mueller as emblematic of everything he had observed. The Americans planned for contingencies, built redundancies into their systems, ensured that essential services continued regardless of circumstances. It wasn't glamorous or heroic, but it reflected a depth of organization, of industrial capacity, of foresight that made the Reich's vaunted efficiency seem hollow by comparison. Lying in his bed, listening to the steady beep of monitoring equipment powered despite the storm, Mueller confronted the implications he had been avoiding. If the Americans possessed this level of medical organization, this abundance of supplies, this capacity for complex logistics, all visible even in a facility for enemy prisoners, then what did that suggest about the broader war effort, about Germany's chances, about the claims of imminent victory that had sustained them through years of increasing hardship? The questions were too large, too threatening to face directly. Yet they worked on him nonetheless. Eroding certainties, challenging assumptions, transforming his understanding of the world with the same steady persistence as the medicines that were healing his wounded arm. The following day, a film crew arrived to document the hospital for what an officer described as training and public information purposes. The German prisoners exchanged uncertain glances. Was this propaganda? A trick? The Americans set up cameras in the main ward, filming routine operations. Doctors making rounds, nurses changing dressings, physical therapy sessions. To Mueller's surprise, they invited German patients to speak if they wished, offering no script, no guidance beyond questions about their care. Corporal Bauer volunteered, describing through a translator his treatment for a lung infection that would likely have been fatal without the antibiotics he received. "I did not expect such care," Bauer admitted. In Germany, we heard very different stories about American medicine. When asked what stories specifically, Bauer hesitated before answering. That we would be used for experiments, that we would receive no real treatment, only enough to keep us alive for interrogation. The filmmaker nodded without surprise. "And the reality?" he prompted. Bauer gestured to the ward around him. "This is not what we were told to expect." Later, discussing the experience, the prisoners noted that no one had told them what to say or how to present their treatment. "Because the truth serves their purposes," Krause observed thoughtfully. "They don't need to invent anything. Just showing this hospital, just documenting what actually happens here. That's propaganda enough. The observation troubled Mueller deeply. If the Reich had lied about American medical capabilities, about prisoner treatment, about relative industrial capacity, what else had been misrepresented? How much of what he had accepted as truth might be equally false? As his discharge from the hospital approached, Mueller found himself reluctant to leave. The facility had become a reference point, tangible evidence contradicting years of propaganda. Each medication, each clean bandage, each specialist consultation served as a rebuttal to what he had been taught about American weakness and German superiority. On his final morning, the American doctor who had treated him conducted a discharge examination, checking his wound and confirming that physical therapy could be continued independently. "You've made excellent progress," he observed. "Follow the medication schedule for another 2 weeks and you should regain full function." Mueller hesitated before asking the question that had formed during his weeks of observation. "Doctor, how many hospitals like this does America have? For prisoners, I mean. For POWs specifically?" "Dozens across the country, with specialized facilities depending on the type of care needed. But they're essentially the same as our military hospitals in terms of standards and supplies. Dozens, each with the same abundance Mueller had witnessed. Each representing a commitment of resources that would have been unimaginable in Germany by the war's later years. And in Germany," Mueller continued carefully, "what do you know about the treatment of American prisoners?" The doctor's expression grew more guarded. "Reports vary," he said diplomatically. "Conditions depend greatly on location, camp administration, and available resources." The non-answer was itself revealing. Mueller had heard whispers about Allied prisoners receiving far less care, about resources dwindling as the Reich's position deteriorated, about triage decisions that prioritized German soldiers based on factors beyond medical need. "Thank you for your care," Mueller said finally. The doctor nodded. "It's my job," he replied simply. "Good luck." As he packed his few belongings, Mueller glanced around the ward one final time. American and German patients in identical beds, receiving identical care, benefiting from the same medical protocols and resources. The scene crystallized everything he had learned during his unexpected education. The ambulance that transported him to the regular POW camp traveled along highways remarkably free of bomb damage, past factories operating at full capacity, through towns where civilians went about their business without the haunted expressions he remembered from German cities. Even in these glimpses through the window, the contrast with the increasingly desperate conditions of the Reich was unmistakable. Years later, when visitors to his small bookshop in Munich would ask about his experiences as a prisoner in America, Mueller would often mention the hospital first, the shock of unlimited medicines, the standardized excellence of care, the profound challenge it had presented to everything he had been taught to believe. For it was there, surrounded by evidence of an abundance beyond imagination, that the mythology of the Reich had begun to crumble. One bandage, one pill, one X-ray at a time. "We entered captivity expecting the worst," he would tell them, trained to believe our enemies were inferior in every way. What we found instead was a system so advanced, so well supplied, so fundamentally different from our own, that it forced us to question everything. The defeat of Germany began not just on the battlefields, but in the minds of soldiers like me, confronted with realities that contradicted every certainty we had been given. Some would nod in understanding, particularly those who had experienced similar revelations. Others, especially younger Germans raised after the war, would struggle to comprehend how thoroughly propaganda had shaped perceptions, how complete the deception had been. "The medicines may seem ordinary now," he would explain, "the procedures standard, the equipment unremarkable. But imagine encountering them after years of believing in German superiority, after being told that Americans were degenerate, disorganized, doomed to defeat." Perhaps that was the most enduring legacy of those German prisoners who could afford to treat you with the same care they gave their own soldiers, while your own country struggled to provide basics for its military. Perhaps that was the most enduring legacy of those German prisoners who experienced American hospitals with their seemingly unlimited medicine. Not just the physical healing they received, but the beginning of a deeper, more painful, yet ultimately necessary recovery from the poisonous ideologies that had led them into war. A recovery that, like Germany itself, would require years of reconstruction, reassessment, and reckoning with difficult truths illuminated under the harsh, revealing light of defeat. In the quiet of his bookshop, surrounded by volumes that explored the human condition from countless perspectives, Muller often wondered how many other former prisoners carried similar revelations from their time in captivity, moments when reality broke through propaganda, when enemy humanity challenged dehumanizing ideologies, when abundance contradicted claims of scarcity. How many, like him, had begun their journey back to moral and intellectual health not on the battlefield, but in the unlikely classroom of an American prisoner of war hospital, where unlimited medicine taught the most limiting of lessons, that everything they had been raised to believe might be built on lies.